guys, this is Dr. Qureshi with you. I have a very interesting thing to show you. So if you can focus here, this is Procara and it's a wet kind of amniotic membrane. In my previous videos, I've done dry amniotic membrane on the cornea, and this time we're going to do the wet. This is Christina from BioTissue, and she's a drug rep for this company, and she's going to tell you more about it.
Hey guys, so today we have Procara. It is cryopreserved amniotic membrane. We are the only cryopreserved amniotic membrane in the amniotic tissue space. When you cryopreserve, you are actually retaining all the biological matrix to allow it to be wound healing. When we look at our dehydrated, sometimes we're just wound covering, which Procara is wound healing. Because of this biological matrix that's on this amniotic membrane, you can see it here. It has the ring specifically because it allows it to be limbal to limbal coverage. Procara is taking the stem cells that are found in the limbus on the eye and allowing them to proliferate without differentiation. So the impact this can have on patients with non-healing ulcers, abrasions, erosions, but also to your uncontrolled dry eye. So we're going to look at now about putting it in.
So basically, if you can focus when the patient, and I will be doing it on a real patient also, but today we wanted just to do a demonstration. So the patient comes in, this is covered like this, we open it, and there's a cap on it. We put saline in this area. The technician does that, and then they just let it sit there. I come back in like 30 minutes, and I take it out. So when you remove it, you have to put it on the cornea exactly like that. So you remove it. It's a little slippery right now. And this is what it looks like. Can you focus on it a little bit? Good. Now this is a very cool eye model Christina brought for us. And this is how we do it. So the patient is looking, we tell the patient to look down first, and we move the upper lid. You can see it? You move the upper lid, and this edge goes inside like that. And then we tell the patient to blink a few times, and then, perfect, thank you. And then we move the lower lid. I'm just going to wipe this area. And then the lower edge goes like that. You see that? And boom, it sits there. Then I take the patient back into the slit lamp and examine the eye just to make sure it's centered. Okay, now Christina is also going to tell us about how we send the patient home. So she's going to show us a little sticky patch, like not like a surgical tape that we used to do in the past. She has something very cool that she's going to show us, because we don't want the patients blinking too much, because we want it to be central, the membrane sitting there in that circular ring, and then the less they blink, the less the movement is. So we want it to be central. We send the patient with that tape.
I apologize. I think I threw away
Oh, we threw away the other one. That's okay. So it looks like a almost like an eyelid shaped tape, and we just put it on the lid like halfway or a little bit more than halfway when the patient is looking down, and then we tape that area. It has an eyebrow edge like that, and then the lid area. And then we send them home. After 2 to 3 days, they come back and I re-examine them and remove it. If they have severe condition, like, such as...
Anytime there is any debridement, so you're removing loose epithelium, which you need to remove any loose epithelium, you just take your dry wax cell, and if you do your little screwdriver test, if the epithelium comes up, and a lot of times a lot more is going to come up than you think, you want to remove all that loose epithelium. If you think about it, patients had epithelium removed, so they need more time for healing. Your less severe conditions, your uncontrolled dry eye, your neurotrophic keratitis, is about 2 to 3 day treatment. When you've done a debridement, you want to keep the membrane in the eye for more 5 days to make sure the patient has completely re-epithelialized.
Good. And the best thing about this membrane is that it works long term. So instead of a few months, like 2 to 3 months that the wet dry membrane works for, this works for 6 to 9 months. So that's a very good thing to remember. Now I'm going to show you how to remove it. This is a cool instrument. Again, Christina brought this for us. So you see the tips. It does not look like a typical forceps because it does not have those sharp edges. So again, you tell the patient to look up. You move the lower lid like this, and then you take this edge underneath this. And of course, they'll be numb with the proparacaine.
And a human eye,
it's going to be easier because right now it's not a human eye, and this is not a patient looking up, but it just comes out like this, like that. It'll be easier on a real patient, and I will show it to you guys on a real patient. So that was about Procara, and thank you, Christina, for showing it to us. And